Again, good morning. This is Kimberly Martone, the Executive Director of OHS. Thank you for all who are in attendance today. Before I start with the formal instructions for hearing, I just want to introduce our new General Counsel for OHS, Anthony Casagrande.
Good morning, everyone.
Hello, Attorney Casagrande. Nice to meet you.
Pleasure to meet you.
So thank you for being here, Tony, with me. Okay, so I will begin by reading the instructions for this hearing. The applicant in this matter, Windham Community Memorial Hospital, Inc., seeks to terminate obstetric services under Connecticut General Statutes 19A 638A5. On July 5th, 2022, the hearing officer in this matter issued a proposed final decision denying the application. By letter dated July 11th, 2022, Windham Community Memorial Hospital, Inc., the applicant requested that the July 27th, 2022 deadline for filing briefs and exceptions be extended until August 26, 2022, which request was granted by the hearing officer on July 12th, 2022. On August 26, 2022, the applicant filed a brief and exceptions and requested oral argument. On August 26, 2022, the applicant further requested that the hearing record be reopened for the purpose of admitting limited new evidence. The request to reopen the hearing record was denied by the hearing officer on September 23, 2022. On November 21st, 2022, the Office of Health Strategy, OHS, issued a notice of oral argument for today. This hearing before the Office of Health Strategy is being held on November 30th, 2022. My name is Kimberly Martone. I'm the Executive Director of the Office of Health Strategy, and I'll be issuing the final decision in this matter. All present on behalf of the agency, also present on behalf of the agency is OHS General Counsel, Anthony Casagrande, which I just introduced. Public Act 22, Section 145, as amended by Public Act 22-3, authorizes an agency to hold a public hearing by means of electronic equipment. In accordance with this public act, any persons who participate orally in an electronic meeting shall make a good faith effort to state his or her name and title at the onset of each occasion that such person participates orally during an uninterrupted dialogue or series of questions and answers, also as the court reporter just requested. We ask that all members of the public mute the device that they are using to access the hearing and silence any additional devices that are around them. This hearing concerns only the applicant's oral argument regarding its exceptions to the proposed final decision, and it will be conducted under the provisions of Chapter 54 of the Connecticut General Statutes. The certificate of need process is a regulatory process, and as such, the highest level of respect will be accorded to the applicant and our staff. Our priority is the integrity and transparency of this process. Accordingly, decorum must be maintained by all present during the proceedings. This hearing is being transcribed and recorded, and the video will also be made available on the OHS website and its YouTube account. All documents related to this hearing that have been or will be submitted to OHS are available for review through our electronic certificate of need portal, which is accessible on the OHS CON website. Although this hearing is open to the public, only the applicant and its representatives and OHS and its representatives will be allowed to make comments today. Accordingly, the chat feature in this Zoom call has been disabled. At this hearing, which is being held virtually, we ask that anyone speaking, to the extent possible, enable the use of video cameras when speaking during the proceedings. In addition, anyone who is not speaking shall mute their electronic device, including telephone, television, and any other device not being used to access this hearing. Lastly, as Zoom hopefully notified you while entering this meeting, I wish to point out that by appearing on camera in this virtual hearing, you are consenting to being filmed. If you wish to revoke your consent, please do at this time. However, please be advised that in such event, the hearing will be continued at a later date. Please let's proceed with this hearing. Counsel for the applicant, can you please identify yourself for the record?
Thank you, Director Martone. This is Jennifer Fusco. I'm an attorney with Updike, Kelly and Stellicy, and I represent Windham Community Memorial Hospital in this CON proceeding for the termination of inpatient obstetric services.
Thank you, Attorney Fusco. Are there any other housekeeping matters or procedural issues that we need to address before we start?
I don't believe so. I mean, the applicant would, in essence, renew their request to admit new evidence, which was submitted along with the brief. And I think you'll hear in our arguments today that there are places where I think it would be helpful for the agency to understand the current status of, the transition of women to other programs, the numbers of women who have been, who have gone to those programs and safely delivered. Those were some of the things we were looking to admit into the record. So to the extent that after hearing this argument, you think it would be helpful to have any of that information admitted, that request remains pending.
Okay, thank you very much. I'll decide at the end. You may please proceed.
Well, if I can jump in for just 1 second, please. This is
Yes, Tony, please.
Attorney Casagrande. Attorney Fusco, you indicated before the hearing began that the slide presentation that you're presenting this morning is all from evidence included in the record. Would you please make that representation on the record?
Yes, that's correct. So the PowerPoint presentation includes all information that is already in the administrative record, none of that new information that we had requested to admit. And I'm happy to provide a copy of this to you via email after the argument if you would like one.
That would be terrific. Thank you.
Perfect. You're welcome.
Thank you. Again, Attorney Fusco, you can proceed with your presentation.
Okay, thank you. Well, good morning again, Executive Director Martone and Attorney Casagrande, members of the Office of Health Strategy staff. Again, my name is Jennifer Fusco and I represent Windham Community Memorial Hospital in this proceeding. I'd just like to briefly introduce the others that are here with us today. We have Donna Hanley to my right, who's the president of Windham Hospital. Karen Boyette is joining us remotely. She's the Executive Vice President, Chief Strategy and Transformation Officer for Hartford Healthcare. Barb Dirty is also over here to my right. She's HHC's System Director of Strategic Planning. And to my left is Jackie Pearl, who's an Assistant General Counsel at Hartford Healthcare. And Melissa Raimondi is providing us tech support from the other side of the table. I'd like to begin today by expressing our appreciation to you and to your staff for the time you've taken in reviewing this proposal. And this includes not just the time spent since the CON application was filed in September of 2020, but the many discussions held between individuals at the highest levels of OHS, Windham Hospital, Hartford Healthcare, and the Department of Public Health leading up to the CON filing. Your guidance helped Windham keep the OB program open for as long as it was safe to do so. And when it was no longer safe to do so, set us on a path to a thoughtful and orderly transition of Windham maternity patients to hospitals better equipped to handle their needs and safely deliver their babies. And while we disagree with the proposed final decision that Hearing Officer Csuka issued, we continue to have the utmost respect for this agency, for its staff, for the hearing officer, and for this administrative process. We also understand that this proposal to terminate Windham OB service is emotional for many, including those women who live in the Windham community, those who've given birth at the hospital over the years. But emotion does not and cannot ever outweigh the need to keep our patients safe and for this agency to issue decisions that are consistent with the law and sound health policy. And so to that end, Windham is extremely disappointed with the outcome proposed by the hearing officer, which requires the hospital to resume providing a service that it cannot safely provide. You've heard sworn testimony, and that's in the record, and you'll see some of it on the next few slides from hospital administrators, clinicians, and experts with decades of experience in the operation of OB services and the delivery of babies that it can no longer be done safely at Windham. Yet OHS refuses to recognize the impossibility of continuing the program. Instead, the agency is asking the hospital to operate a program that it knows not to be safe, and in doing so, to jeopardize the health and safety of mothers and babies in the Windham community. We'll talk more today about the applicant's evidence and the proposed final decision that we're here to challenge, but what we really need you to take away from this argument is that patient safety must be considered above all else in the final decision issued by this agency. Patient safety is at the forefront of everything Windham Hospital and HHC do every day in the communities that they serve. So we're asking OHS to put patient safety first as well, ahead of emotion and rhetoric, and to do what's best for mothers and babies in the Windham community. This means either issuing a final decision approving the termination of OB services at Windham, or coming to the table to discuss a settlement that addresses any remaining concerns the agency has with the applicant's proposal. Because the evidence of the record is clear and convincing and unequivocally supports approval of this critically important CON. So just by way of brief background, Windham Hospital's current inability to staff and safely operate its OB service began with Mansfield OBGYN's departure in 2014 when they decided to relocate their deliveries to Manchester Memorial. And you can see from the slide that's up there that, several years later, as of FY 2017, a vast majority of women from the Windham service area were in fact delivering at Manchester. Women's decisions about where they give birth are influenced by their obstetricians. If their obstetricians are delivering elsewhere, they're going to deliver elsewhere. And this is why we saw this precipitous decline in volume of 277 births, or approximately a 74% volume decline between 2014, when Mansfield was still there, 376 babies were delivered. In 2019, which is 99 babies were delivered. After Mansfield OBGYN stopped delivering babies at Windham, the only women delivering at the hospital were patients of the Windham Women's Health Clinic. And as you heard at the hearing, or as you saw in hearing testimony, that clinic is staffed by a single obstetrician, Dr. Eugene Rosenstein, who is unable to cover the OB service 24/7. So call coverage from other private practices in the area is required. And as you can see from this timeline, which comes from the record in this matter, Windham OB lost its primary call coverage physicians, OBGYN services out of Norwich in December of 2019. I believe they notified us that they were leaving in September of that year. We notified OHS in November that this was happening and that the program, which had already been in a fragile state, was in an even more fragile state. And so if you look at this timeline, you could see that despite the hospital's best efforts for 5 or 6 years to piece together coverage and find a permanent call coverage solution using community providers, individuals from community providers, locums, it was never able to do so in a safe and consistent manner, which necessitated suspension of the service in July of 2020. I think an important thing to understand is that Mansfield OBGYN services, these are private physician practices, and they're not coming back to Windham. Okay, there are affidavits in the record that were requested by the original hearing officer attesting to the fact that neither Mansfield OB, which is now, I believe, part of Women's Health USA, or OBGYN services has any intention of either returning to regular deliveries at Windham or of providing call coverage at Windham. And it's just so important to understand that these are private physician practices, and we have absolutely no control over where they choose to deliver their babies or whether they're willing to provide call coverage. And, despite what you could read in the proposed final decision and what members of the public have said, there's the evidence shows there are no other realistic options for OB call coverage in Windham. The same is true for nurse staffing, which had become a challenge, and the ability to secure consistent coverage by ancillary physician providers like neonatologists. Unfortunately, this is a case of low delivery volume driving a lack of desire on the part of obstetricians and other clinical staff to practice in Windham, resulting in an inability to staff the unit safely. Low delivery volume, as the evidence shows, also presents a myriad of quality risks based on an inability to maintain provider competencies. Ms. Manley testified at the hearing that she had discussions with the Department of Public Health in June of 2020, and they expressed concerns about Windham OB's ability to, deliver babies, given the inability of the physicians and nurses and other clinical staff to maintain their competencies. Because when you have only 1 or 2 babies being born at a hospital each week, and when there's no regularity of staffing because you have 1 staff obstetrician, no call coverage physicians, and you occasionally have to resort to using locums, the hospital cannot ensure that when the unexpected occurs during childbirth, which happens often, that the clinicians are going to be able to work together as a competent and cohesive team and deliver that baby and keep that baby and mother safe, and the results can be catastrophic. As I said, the proposal at its core is about patient safety and the need to close a labor and delivery service that can no longer be operated in a safe, consistent, and sustainable manner. But it's also about ensuring that all women from the Windham area, including Medicaid recipients and other at-risk populations, have continued access to high-quality OB care. But it needs to be in the right environment where patient safety can be ensured, even if that means delivering their babies somewhere other than Windham Hospital. Now, the briefs and exceptions go into a tremendous amount of detail regarding the errors and omissions in the proposed final decision, and I don't think we need to take the time today to go through each one, but there are certain key factual findings and legal conclusions based on those findings that are simply incorrect, and that we believe led the hearing officer to propose denial of the CON. And we feel strongly that these errors and omissions need to be corrected so that the executive director can have a complete and accurate understanding of the proposal in making her decision. So moving on to the actual findings in the decision. Excuse me, this is by no means an exhaustive list, but in the interest of time, just a summary of those key issues that we believe are driving the proposed denial. Let's start with the hearing officer's conclusions about the impact of this proposal on the quality of obstetric care in the region. If you look at section E of the proposed final decision, hearing officer Csuka finds that Windham has not satisfactorily demonstrated that the proposal will improve the quality of healthcare. This is incorrect. The proposed termination of labor and delivery services at Windham and the planned and effective transition of women to other hospitals in the area that are better equipped to handle their needs, including Bacchus, which was recently designated as a high-performing maternity hospital nationally, in fact, improves the quality of obstetric care that these women are getting. Now, the evidence in the record, and you'll see from this slide, which came straight from an expert report that I believe was in the pre-filed testimony, Windham is in the lowest decile, or decile 1 for birth volume, at 100 or fewer births each year, and that number had become pretty consistent after Mansfield OBGYN left. Less than 100 births per year is low obstetric volume. I mean, simple math, it's about 2 births a week. And the hearing officer acknowledges in the decision that we have put in evidence to address how diminished volume negatively impacts quality, and that very low volume leads to higher complication rates, which is one of the arguments we're making. He also acknowledges that other area hospitals, including Bacchus, are in higher deciles for birth volume. They deliver more babies, which is associated with lowered odds of adverse outcomes. However, the hearing officer discounts this peer-reviewed literature and expert opinions regarding the adverse impact of low birth volume on quality, claiming that the applicant neglected to fully analyze the impact of Windham's rurality on access to care, and by extension, quality of care. And in doing the analysis himself, he decided that the rurality aspects of this proposal outweighed well-documented quality concerns around low volume, and more importantly, the clear and convincing evidence in the record that Windham cannot staff the OB unit in a manner that allows for its safe and consistent operation. And so just to kind of go through, because I think this point about rurality is really important. And the slides we're going to show you now come from a brief and links in a brief that was cited by a member of the public and that the hearing officer cited in the proposed final decision. The hearing officer's analysis is flawed in that it assumes rurality is the issue here, okay? It assumes that rurality is what's causing the low volume and the issues that arise from a low volume OB service, and that rurality precludes a finding that women can still have adequate access to care if the Windham OB service closes. And these assumptions by the hearing officer drive an incorrect conclusion that the proposal does not and cannot improve both quality and access for OB patients. The truth is, based on evidence in the record, Windham is not a rural hospital for purposes of maternal health. Okay, the literature cited by the hearing officer in support of his conclusion that Windham is rural for maternal health belies his finding. Okay, there are a few important things to note. The hearing officer, the applicant never stated or implied that Windham is a rural hospital for maternal health purposes, as the hearing officer claims we did, because it isn't. And the CMS brief on maternal health cited by the hearing officer shows, and you can see it on this slide, that the only rural county in Connecticut for purposes of maternal health is Litchfield County in the extreme northwest corner. Windham County is classified as a metropolitan statistical area. You can see it circled there by the Office of Management and Budget, which is the entity that does the designations referenced in the CMS brief. And to be considered rural for purposes of maternal health, an area either needs to be a micropolitan statistical area, which is what you see labeled as kind of Torrington, Litchfield up in the northwest corner, or a non-metropolitan area, which would show in white if there were any of them in the state of Connecticut. And you can see the striking difference, again, using the OMB links in that brief, between states like Connecticut and truly rural areas of this country, like Texas and Montana, where women may need to travel hours to access obstetric services. And if you look at that map of Montana, or if you look to the western side of Texas, every single one of those white counties or CBSAs is a rural CBSA, and even the light green ones would be considered. So, and if you compare that with Windham, the next closest hospital is Bacchus. It's only 16 miles away and 26 minutes away by car. And just for reference, that's about how far and how long it takes to get from Cheshire to Yellowhaven Hospital. Okay, we're talking 16 miles, less than a half an hour. And there's testimony in the record from the hospital's expert witness, John Rodis, that many women, he worked at UConn and was at St. Francis for years. Many women in the state will voluntarily travel much farther than this, upwards of an hour, to deliver their babies at open health centers or in other hospitals of their choosing. The hearing officer also misquotes, and I think this is an important point, although a technical one. He misquotes literature regarding how rural hospitals are defined, claiming that incorrectly that any hospital with less than 200 births is rural. And this is not what the literature says. And it's a nonsensical conclusion, given that there are probably many small urban hospitals in this country that do less than 200 births a year. And nor does the community health needs assessment for Windham, which was cited throughout the proposed final decision, establish that the county is rural or that the hospital is rural for maternal health purposes. And to state otherwise, as the hearing officer has, is a mischaracterization of the evidence before the agency. The hearing officer correctly acknowledges that since the Windham OB program was suspended for safety reasons in July of 2020, there have been no quality incidents associated with the redirection of maternity patients to nearby hospitals better equipped to handle their needs. And that number is now closer to 200 babies safely delivered at Bacchus. There have also been no issues whatsoever with the ability to coordinate care for patients in the Windham Clinic who are either delivering their babies at Bacchus, which is part of the HHC integrated healthcare delivery system, or in other area hospitals where their care is carefully planned and transitioned in the months leading up to delivery. And so it has been demonstrated in practice for now close to 2.5 years, quality can and has been enhanced by this proposal. Now, what is at issue when we're speaking about quality is the hearing officer's complete disregard for the substantial evidence in the record establishing Windham's inability to safely staff and operate the OB unit. That's the pivotal issue in the CON proceeding in terms of quality. And the hearing officer's focus on this false narrative of rurality causes him to miss this critical point. The hearing officer also makes specific findings regarding access that we believe are inaccurate and are leading to erroneous legal conclusions. As a threshold matter, he seems to be suggesting that a termination of services needs to enhance access, that this proposal to terminate Windham OB has to enhance access to obstetric services in order to be approved. And while we maintain that it does enhance access to those services, that's not the standard for termination of services CON. This agency has consistently found that a proposal to terminate services that maintains adequate access to those services meets the requirements of the statute, and that's exactly what this proposal does. Again, evidence in the record shows, and the hearing officer has acknowledged, that nearly 100 women from the Windham Clinic safely delivered their babies at Bacchus, a top-tier maternity hospital, between July of 2020 and September of 2021. Windham has ensured access to OB services in the manner suggested by an independent expert that they had retained back in 2017 to evaluate the program, Dr. Sindhu Srinivas, when she recommended closing the unit, citing the ability to have a sustainable and safe transition of women to existing hospitals within a reasonable distance to Windham. So she recommended closure for many reasons, one of them being she considered access and determined that there was sufficient access at hospitals nearby Windham. And sort of despite some sensational and inaccurate public comments to the contrary, babies are not being born to Windham mothers on the side of the road in ambulances. They're not being born in helicopters that can't fly in inclement weather. These are all red herrings, and there is actual sworn evidence in the record to explain the circumstances under which the single ambulance birth occurred to a woman who was not even a patient of the Windham Women's Health Clinic. But again, to refocus, we now have 2.5 years worth of data validating the applicant's claim that access can and has been maintained, and women and their babies are being well cared for at Bacchus and other area hospitals. And again, there have been no incidents. One of the things the hearing officer focuses on when he's doing his accessibility analysis is the availability of transportation for Windham mothers. He cites literature regarding transportation barriers to access generally for women from areas like Windham, where transportation resources can be limited. But he ignores actual data showing that nearly 100 women safely delivered babies at Bacchus in that timeframe, July 2020 to September 2021. And he talks about the fact that most women arrange for their own transportation to the hospital to deliver as if it's a bad thing. It isn't. What that shows is that women from the Windham area have adequate transportation resources to obtain labor and delivery services 16 miles away at Bacchus or at other area hospitals of their choosing. And for those that don't, Windham is committed to providing transportation services, either by ambulance or other means, at no cost for anyone who needs them. And this includes mothers and their support persons, and as evidence in the record clearly demonstrates, it's not just for transportation to the hospital, as the hearing officer suggests, but transportation home as well. And you can see that, I believe, in the final slide. The question was specifically asked of Ms. Hanley at the hearing, and she acknowledged that. And, my point here being, the hearing officer looked at sort of literature and what could happen theoretically to people who live in these types of areas, and actual evidence has to take precedence over theoretical information and assumptions. I also want to touch briefly on the statutory criterion around access for Medicaid recipients and other at-risk populations. The proposal does not adversely doesn't adversely impact access to care for anyone, and that includes Medicaid recipients who make up a bulk of the Windham OB patients. It's worth noting Windham continues to provide critically important prenatal and postpartum care at the Windham Clinic, and has no plans to discontinue these services, which form the bulk of a woman's care and travel around pregnancy. Okay, and as we just discussed, Windham has ensured continuous access to labor and delivery services without disruption for the last 2.5 years. So the hearing officer again speculates, based on unsworn public comment, about the possibility of a disruption in OB services for Medicaid recipients. But speculation is entirely inappropriate when there's actual evidence in the record to prove otherwise. Namely, that nearly 100 women, and you can see from here, a majority of whom our Medicaid recipients, safely delivered their babies at Bacchus, a high-performing maternity hospital, between July of 2020 and September of 2021. So what that's showing you is this is the snippet of women between when the service was suspended in the last month before we began preparing for our public hearing. Those women made it and delivered safely at Bacchus, and a vast majority of them are Medicaid recipients. And so, although there have been changes to the manner in which these women access OB services, our position is those changes have been favorable, and they favorably impact the quality of obstetric care. The agency, again, can't speculate that Medicaid or recipients or indigent persons, or any patients for that matter, might be negatively affected by a termination of services as a result of reduced access, when the evidence shows that access has been maintained and improved. Again, this is a question between do we look at literature and hypotheticals, or do we look at the actual evidence in the record and the actual data of what is going on in the Windham area? The hearing officer also incorrectly analyzes the statutory criterion regarding reduced access to services for Medicaid recipients and whether good cause exists for such a reduction. First and foremost, no reduction in services for Medicaid recipients is occurring. Women are still obtaining their prenatal care at Windham, during which time they arrange for deliveries at Bacchus or another hospital of their choosing, the same as they would arrange to deliver at Windham. The location has changed, but the service continues to be provided and has been provided seamlessly for the last 2.5 years. But in analyzing good cause for this supposed reduction in services, the hearing officer chose to focus on Windham's alleged failure to pursue all avenues available to it for obstetric coverage. Specifically, he's taking aim at the applicant's alleged failure to contact UConn Health and the physicians that cover Dade Kimball Hospital's OB service to see if they could provide coverage at Windham. And these findings by the hearing officer just generally couldn't be further from the truth. Expert witnesses have testified that neither UConn nor Dade Kimball physicians have the ability to provide sustainable OB coverage at Windham. And that's what we need, sustainable, consistent, long-term coverage at Windham. In addition, just the OHS staff is well aware of the substantial efforts that Windham has made, in the 5+ years leading up to the CON filing, to staff the OB unit in any way, with any physicians they could find to ensure they could continue to operate safely. The hospital updated the Department of Public Health and OHS on a regular basis about its efforts. And so to suggest, as the hearing officer does, and I quote, that Windham did not bother to pursue coverage options is absolutely incorrect. The hearing officer also ignored clear evidence in the record regarding what's really the impossibility of obtaining consistent ongoing OB call coverage from either UConn or Dade Kimball. This entire line of questioning about UConn and Dade Kimball was initiated by unsworn public comments made by an individual known to this agency who has his own reasons for trying to keep the Windham OB service open that have nothing to do with the health and safety of mothers and babies. And this individual was given every benefit of the doubt by the hearing officer, despite the fact that the statements he made about UConn and Dade Kimball were proven to be false in post-hearing submissions. He was asked to validate those statements and he couldn't. But at the same time, the hearing officer gives no credence to anything that was said by Windham's sworn expert and fact witnesses who have firsthand knowledge of the practicability and the feasibility of these coverage solutions. The reality is neither UConn nor Dade Kimball offers a realistic OB call coverage option for Windham. As the agency heard in sworn testimony from Dr. Adam Borgita, who happens to be the former site director for the UConn Maternal Fetal Health Medicine Fellowship Program, UConn residents can't cover Windham due to issues around travel time and work hours. Not to mention the fact that residents cannot practice without attending physicians. The only OB attending physician at Windham is Dr. Rosenstein. And just like he can't be available 24/7 to deliver babies, he can't be available 24/7 to supervise residents. Similarly, the physicians who cover Dade Kimball OB service do not have the capacity to cover Windham. There's evidence in the record showing that a number of local obstetricians, primarily from OBGYN services out of Norwich, which used to cover Windham, were and still are covering shifts at Dade Kimball because the Dade Kimball practice can't cover its own OB service, let alone Windham. And this was one of the things that we were looking to introduce, which is affidavits from several of those physicians attesting to the fact that as of today, or I guess as of August 26th, when the brief was submitted, they were still providing that coverage at Dade Kimball. And so I briefly want to, in the interest of time, I briefly want to go through, there are a few other statutory decision criteria that the applicant maintains have been met despite the hearing officer's conclusions to the contrary. These are criteria around cost effectiveness, diversity of providers and patient choice, clear public need, and consistency with the statewide healthcare facilities and services plan. And our arguments with regard to these criteria are set out in a lot of detail in the briefs and exceptions, so we won't belabor them today, but it is worth pointing out a few things for your consideration. With respect to cost effectiveness, the hearing officer found the proposal wasn't cost effective because of the slight difference in the cost of delivery for the minimal number of commercially insured patients of the Windham OB service. And that slight difference in the cost of delivery is $10,000 in total for the entire program. And that's certainly not enough to make a proposal cost ineffective. He also claims that Windham's transportation program and what the hospital would need to do to fund that made it cost ineffective. But at the same time, he acknowledges that that is offset by the $2.5 million in cost savings associated with discontinuance of the program. And the third basis he used was that we were not covering transportation home from the hospital for patients, and patients would need to pay for that. And based on what you saw of hearing testimony from Ms. Hanley, that's absolutely false. We do pay for that for patients and support personnel. With respect to diversity of providers and patient choice, The way I read the decision, the hearing officer saying that anytime you terminate a service and have one less option for that service in an area, you have failed to meet this decision criteria. That every single termination of services CON will fail on this criteria. And again, that's not how this agency has historically interpreted this criteria. You just need to ensure that they're maintaining, that there are adequate providers to offer access and that there are options, right? And here what we have are HHC hospital options for delivery. You've got Bacchus and you've got Hertford Hospital if the patient wants to go there, and you've got non-HHC choices in Manchester and Bay Campbell. And this ensures diversity of providers and patient choice as that criteria has historically been interpreted by the agency. In addition, we were kind of surprised that the hearing officer didn't make a finding on clear public need and said it was not applicable to a termination of services CON. We feel we should have determined that there's a clear public need based on factors to terminate based on factors including declining volume, quality and safety considerations, recruitment challenges, and an inability to maintain adequate physician staffing. And such a finding would have been consistent with other OB service termination CONs where the agency acknowledged the clear public need to terminate a service that could no longer be safely provided. And lastly, based on the totality of actual evidence in the record around these decision criteria we've been discussing, it's clear that the proposal is consistent with the state health plan. And finally, I'd be remiss if I didn't touch briefly on the procedural errors, irregularities in this matter and their impact on the proposed final decision. Again, I won't go into everything, but most notably, I think it's the use of unsworn public comment for a significant percentage of the findings of fact and the conclusions of law deriving from those facts. This agency accepted what was in essence testimony from unsworn members of the public while ignoring sworn evidence offered by the plaintiff. And the applicant was given no opportunity to cross-examine or otherwise challenge these commenters who are not in fact witnesses offering evidence, and that deprived the applicant of its due process rights. And I think it's important for you to understand and recall some of kind of the more egregious findings that were based on public comment, including findings that cite articles that have nothing to do with OB services, and in some cases have nothing to do with healthcare services at all. Findings that reference studies from foreign countries that are not backed up by any peer-reviewed literature or studies that we can find done in the United States. Findings that question the professional character of an expert witness, Dr. Srinivas, a well-respected physician, accusing her of potentially colluding on an expert report without any justification, and then, refusing to accept new and updated evidence into the record to address the claimed deficiencies in the CON submission. And, as far as procedural errors, perhaps most egregiously allowing the CON application to remain pending for more than 2 years, despite this agency's belief that women are being denied access to OB care. And finally, in that regard, I think the change in hearing officer post-hearing also deprived the applicant of his due process right to have this matter decided by an individual who, like what you're doing today, attended the hearing, observed witnesses in real time, had an ability to ask questions and to personally assess the credibility of those providing testimony. So in making his recommendation that the CON be denied, our belief is that the hearing officer ignored the better evidence in the record, showing that the statutory decision criteria around need, access, quality, cost, equity, and choice have been met, and that the approval of the application is in the best interest of patient safety. He ignored the evidence that nearly 100 women from the Windham Clinic have safely delivered their babies at Bacchus, a nationally recognized top-tier maternity hospital, without incident. He ignored evidence about how access has been and will continue to be ensured for all women, and how all women, including those at risk, are now receiving higher quality obstetric care at hospitals better equipped to handle their needs and the needs of their babies. The reality is Windham cannot safely operate its OB service due to a lack of available obstetricians and other clinical staff. There's not sufficient physician coverage to sustain a 24/7 service in a safe and consistent manner, with competent providers ready and able to deliver babies when unexpected emergencies arise. If the unit can't be operated safely, it needs to be closed, and women need to be redirected to other high-quality, accessible OB programs in the area. This is the true narrative of Windham's CON proposal. proposal, not the piecemeal arguments that the hearing officer has advanced based on unsubstantiated public comment and conjecture. OHS must look at the reliable and substantial evidence in the administrative record, which unequivocally favors approving the CON request. So where do we go from here? If a final decision is issued denying the CON, the applicant intends to file an administrative appeal because there is no way to safely operate the Windham OB unit going forward. It's in the best interest of women and their babies for OHS to approve this CON or to come to the table to discuss a resolution that protects the community's interests in preserving high quality, accessible OB care and enhancing women's health services. And we welcome the opportunity to have these discussions with you and your staff. So thank you again for your time. Sorry that was a little longer than 15 minutes, but we appreciate your time today.
Thank you, Attorney Fusco. All right, I do not have any questions at this time. So at this point, I mean, Tony, are you all set?
Everything's good. Yep. Thank you very much. Thank you all
Okay.
for your
All
participation.
right, thank you. All right, then I thank you all for attending today. I will issue a final decision in this matter in accordance with Chapter 54 of the Connecticut General Statutes. And here I am. I do not need those attestations, Attorney Fusco, that's fine.
Okay.
So therefore I'm closing this hearing at this time.
Thank you.
Thank you.
Thank you very much.
Thank you all. Have a good day.